Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Haris Farhan bin Asa. I am from Group 8 and today my group will be presenting on the topic managing the spread of COVID-19 pandemic based on Islamic perspective. My mention number is 2010577 and my teammates are Rehana Husna, Muhammad Syarul Amri, Muhammad Amirul Ashraf and Muhammad Hakim. For the introduction part, there are three main things that are going to be highlighted. The first one is the origin of COVID-19. The second one is transmission of COVID-19, and lastly, COVID-19 outbreak throughout the years. As we all know, the origin of this disease is coming from China. The WHO, China Country Office, or the World Health Organization in China detected a pneumonia of an unknown etiology in Wuhan City, Hubei Province, back in China on 31st December 2019. We are also aware at that time the factor of this disease is coming from the human seafood market, where the people in the market cooks food that are unusual or inordinary to us as a human, such as cooking bats, cooking snakes, cooking scorpion, etc. Research in China shows that the highest possibility of this disease was originating in horseshoe bat, or mainly just bat, which is one of the variety of food in the market. Later then, this unknown etiology was then found as a new type of coronavirus. Starting on January 20th, the virus started to spread around the world, and the number of cases started to increase exponentially. Many people have died. After 10 days, on January 30th, all countries agreed to declare this new type of virus as an international concern, and all countries should act accordingly to prevent this virus from spreading. Throughout the time, we already witnessed the virus mutating itself from the very first coronavirus to the Delta variant and the latest deadly variant, which is really dangerous, which is the Omicron, whereby it is originating from a 19-year-old South African private university student in Ipoh who arrived from South Africa to Malaysia through Singapore on November 19. This already shows us that the virus can evolve many more times if you don't prevent it from spreading. Next is about the transmission of COVID-19. As we all know, COVID-19 is a virus that are spread through airborne. It is likely spread via droplets in the air, and it can affect our respiratory illness without us noticing it. These droplets are typically from an ill person whom have been affected by the virus. An affected person can be known if they have these symptoms. The symptoms are fever, dry cough, tiredness, sore throat, and runny nose. So, we must be extra cautious if we encounter these symptoms. On March 11, COVID-19 was declared officially as a pandemic, and it is really dangerous to us. Throughout the years, we already witnessed the COVID-19 pandemic and the outbreak in our country, and what is the consequences to us as a society, as a country, in terms of social and economy. There are three major waves that will be highlighted in this slide. The first wave is dated on 25th January, where KKM detected the first 3 cases of COVID-19 located in Johor, and the cases increased to 22 by February 15. The second major wave, which is much more worse than the first wave, started on February 27, where people from infected countries started to show symptoms such as fever, dry cough, sore throat, etc. And the clusters of cases began to spread really quickly, very high transmission rate. And one of the example of the clusters is Sri Petaling Tabligh clusters, which is the most big major cluster during that time, where the KKM detected about 1,701 cases related to the Tabligh cluster. And later, MCO was announced on March 18. The third wave occurred in early October, where large clusters of cases have been identified nearly in Sabah. This is where the Sabah state election were conducted by the government, and the election just worsened the situation, and it is dated on September 26. Next, we are going to emphasize on the point of our presentation on how to manage the spread of COVID-19 pandemic based on Islamic perspective in 4 different aspects: medical prevention, theoretical prevention, educational prevention, and sociological prevention. I'm going to pass the platform to Sister Rehana.
Hi, Assalamualaikum. My name is Raihana Husna binti Muhammad Rizwan. My matric number is 2015208. And I am going to talk about managing the spread of COVID-19 pandemic by medical prevention. The function of religious deeds medically in the struggle against COVID-19. Before the vaccine of COVID-19 was created, everybody was waiting patiently for it to come out. So while the world awaited for the vaccine, physicians and health officials worked to find appropriate therapy approaches and medications to help patients boost their immunity system. One of the most crucial techniques was the injection of recovered COVID-19 victims' plasma, which contain the necessary antibodies that would allow a patient's immune system to fight the infection. Desperate patients and their families were often compelled to pay excessive fees to obtain this plasma. From an Islamic ethical standpoint, this incident called into doubt the permissibility of selling plasma from recovered patients, particularly in a pandemic situation. The International Center for Electronic Fatwa of Al-Azhar released a statement on this subject, stating that withholding plasma by recovered COVID-19 patients without a legitimate cause was ruled prohibited and wicked. After the COVID-19 vaccine is introduced, vaccines that operate as self-immunity have been developed to inhibit the virus spread. One of the ideas that developed in the aftermath of the coronavirus pandemic is herd immunity, or community immunity, as a means of combating the disease. In its most basic form, herd immunity refers to the circumstance in which a substantial segment of the population develops immunity to a disease, either by vaccination or prior exposure to the disease. Only when the number of immune people increases does transmission ceases. Most medical experts support the idea of achieving community immunity through vaccination rather than through mass exposure to the disease. However, one of the most important ethical issues from an Islamic standpoint concerns the contents of a certain vaccine and whether it contains a religiously prohibited substance. The Perlis State Mufti Department issued an official fatwa stating that the COVID-19 vaccine is permissible and must, wajib, be taken by the government-specified group. According to Malaysia's Director of Health, variations such as Delta can be transferred among close contacts in as little as 5 seconds. As a result, the vaccine appears to be capable of having a good impact on efforts to prevent the development of this epidemic, and it should be considered by all parties so that the present harm can be addressed as soon as possible. In the absence of safe and effective vaccination, consists in the implementation of basic preventive measures such as social distancing, disinfection, wearing of masks, and regular washing of hands. On a side note, failure to treat treatable diseases before they worsen would constitute recklessness and negligence under Sharia standards. As a result, it is possible to deduce that the Fatwa the Perli State Mufti Department's statement on the implementation of the COVID-19 vaccination is consistent utilizing fiqh approaches. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Syara Abdul bin Sahimi, metric number 2018267. Today I will be presenting about the theoretical prevention function of theory deeds educationally in the struggle against COVID-19. Introduction to theoretical. What is theoretical? Theory is used in program planning to understand and explain health behavior and to guide the identification, development, and implementation of interventions. When selecting a theory to guide health promotion or disease prevention initiatives, a variety of criteria must be considered, including the specific health condition being addressed, the population served, and the circumstances in which the program is being implemented. Typically, health promotion and disease prevention initiatives are based on one or more theories. For example, in COVID-19 prevention, theory of planned behavior is used to study and conclude that the keys to people's performing social distancing is include improve and effective risk communication that may improve risk perception and enhance control behavior. So what is this theory of planned behavior? Theory of planned behavior is a psychology theory that connects beliefs to behavior. According to the idea, three basic components which are attitude, subjective norms, and perceived behavioral control affect an individual's behavioral intention. In turn, one of the theory principles is that the behavioral intention is the most fundamental predictor of human social behavior. This theory is very important because it connects people's beliefs to behavior. For example, to make people comply with the rule of social distancing, they must first believe that the social distancing is effective. This is because social distancing has a lot of burden to people, namely in businesses. Like if before a business can serve or feed like 100 people in their store, now they can only feed 20 people. This can make they earn less money on the potential customer that cannot come to the store because of this social distancing. Next is ceremony. For example, like wedding, less people can come to our weddings to celebrate our wedding, our marriage, and our normal lifestyle, like hugging our parents, hanging out with our friends and family, and so on. So they need to believe that social distancing is effective in preventing the transmission of the virus, thus lowering the case, and in return will avoid movement control order, which can make business more suffer and our everyday normal life will be more difficult. And also speed up the process to come back to our normal life before this pandemic happened before they practice before they practice the social distancing rule in their normal life. Next, we proceed to examples of methods that can be used to help in this theoretical prevention. The first one is campaign. uh, Example of campaign is awareness campaign on the danger of COVID-19. Next is pamphlet. In this COVID-19 era, we cannot distribute physical pamphlet, so we resort to sharing infographic, poster about the COVID-19 facts to educate people about the virus. Next is social media. Social media is like example of social media is like the Twitter account of KKM, which is the Ministry of Health Malaysia. They post about the daily cases, the number of deaths, and also the number of recovered person. And lastly, conventional message. Conventional message is a message that doesn't use the internet. It uses the credit, which is 2G. This method is important because although nowadays smartphones are normal, but there are a lot of people that don't have one. For example, like the elderly and poor people that couldn't afford one. This method also can reach to the people that doesn't have a stable internet connection to access the information that the government or the health department want to distribute. Lastly, we go to the importance of theoretical prevention. The importance of theoretical prevention is to educate people on how to reduce transmission of the outbreak. For example, like the social distancing, how to wear masks properly, and to always wash hands regularly. Next is to convey the information to the people because only the masses can stop this pandemic. And lastly is to prevent public panic. Public panic occurs when a group of people try to spread false information to make the public scared and panic. This can be avoided by educating the public enough to make them know to differentiate between the genuine and fake information. The government also can warn the people about fake news or false information that has been circulating around. That's it for me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Hakim bin Risham. I will continue the presentation on the educational prevention aspect. The COVID-19 pandemic has produced consequences that have the potential to alter various elements of human life. The threats we confront are becoming more connected as the globe grows more interconnected. The COVID-19 outbreak has crossed national borders and is still spreading. People of various countries, educational levels, economic levels have been affected. The same cannot be true for the consequences, which have overwhelmingly harmed the most vulnerable. Education is no different. Students from wealthy homes with the backing of their parents and a desire to learn may be able to make their way to the other learning options, but for low-income families, they were constantly left out. It was narrated from Anas bin Malik that the Messenger of Allah Subhanahu wa Ta'ala said, "Seeking knowledge is a duty upon every Muslim, and he who passes knowledge to those who do not deserve it is like one who puts necklace of jewels, pearls and gold around the neck of swine." So according to Prophet Muhammad's teachings, the desire for knowledge is the obligation of every Muslim, male and female. During these difficult COVID-19 times, new media such as smartphones, social media, computers are chosen instrument for pursuing online learning sessions. Changes in the educational area occur alongside changes in various social arrangements in society. In scenarios and conditions that do not allow for face-to-face engagement and conversation on school and college campuses, the learning process must continue to function. In response to the increasing spread of COVID-19, the Ministry of Education and Culture issued the implementation of education policies in the emergency period for the spread of COVID-19, which stated that it is recommended to carry out the learning process from home via online learning. The circular letter emphasized the importance of academic reform in the implementation of the learning process for school and university students during the COVID-19 pandemic. The most significant change is in the learning approach, with teachers and lecturers being compelled to conduct online learning. Due to that, media technology is recommended for use in the teaching and learning process, as well as to spread the message of Islam and good human values to the people. Relevant television channels, television programs, multimedia, and video presentation can be used in the teaching and learning process and to spread the message of Islam and good human values to the people. For example, during this COVID-19, people from all over the world can listen to live or recorded talks from well-known Islamic scholars such as Mufti Menk, Ustaz Abdul Somad, Ustaz Datuk Dr. Zulkifli Muhammad Al-Bakri, or Professor Dr. Mohaya, and even participate in online preaching sessions by asking questions and providing feedback. People might spend more of their time private, whether alone or with their family, whether isolated at home or working from home. We can use these religious online learning and communication platforms to gain diverse information and knowledge. More importantly, preachers could be active online during the COVID-19 stay-at-home situation, preaching, teaching, providing consultation, using various online media platforms such as live session through Facebook, Instagram, Google Meet, Zoom, and others to spread the knowledge and information to the people. Quran recitals and prayers are among the other learning events that are streamed online to preach the message of Islam. During the COVID-19 scenarios, when confronted with the problem of online distance learning, the educational process that make use of new media and digital platforms should not separate education connected to divinity, morality, and ethics in line with current global development. In accordance with Islam and its Islamic principle, digital media technology may be employed for education and knowledge transmission. In truth, Islamic teachings encourage Muslims to seek knowledge and innovation in science and technology in order to better their daily activities. And the primary purpose of these actions should be praised to Allah Subhanahu wa Taala. In general, there is abundant information available on Islamic viewpoints on online learning requirements. As a result, the goal of this research is to add to the current literature by offering Islamic viewpoints on the ethics of utilizing modern media in education in general, and specifically during COVID-19. That's all from me. Thank you.
Assalamualaikum. My name is Muhammad Mirul Ashraf bin Muhammad Razli. Mention number is 2013137. So I will present the sociological prevention, the function of religious deeds sociologically in the struggle against COVID-19. So the introduction. For decades, religion has provided explanations and answers to existential questions and queries that can emerge during a pandemic. This characteristic of religion has helped communities in finding answers and meanings to their confusions. During a pandemic, healthcare professionals are often unprepared in answering the patient's religious beliefs regarding the disease. Moreover, patients are faced with religious cliches and stigma that results because of religious beliefs and practice. To overcome the religious stigma, a deeper understanding of religious beliefs and values is required so that a perception or practice change can take place. Therefore, the inclusion and collaboration of spiritual leaders with healthcare professionals are really needed to ensure a holistic understanding and overcome the stigma that can shape as a barrier for reaching an optimal therapeutic outcome. So the history of religion on COVID-19 is that many people have attacked religion as a part of the problems during the COVID-19 pandemic. The first time that it was initially in South Korea, where nearly 5,000 confirmed cases of COVID-19 were traced back to patient 31, an infected individual who worshipped in Shincheonji Church of Jesus in Daegu. So this is the first time that many people blame religion on COVID-19 spreading. They blame religious people help to spread COVID-19 and make the situation worse. Meanwhile, in Malaysia, 513 people tested positive with COVID-19 after attending a religious gathering, which is the Sri Petaling Tabligh group, which pushing the country to a lockdown. During this time, many Malaysians are blaming the Tabligh group for the lockdown and the breakout of COVID cases in Malaysia. So the first thing is how religion can help to combat COVID-19. religious leaders are some of the most respected figures in Malaysia or even in the world. Their influence on their followers can greatly benefit the efforts against COVID-19. So they can give advice to many people, because many community members listen to their religious leaders. So they can advise people to help stop spreading the COVID-19, and therefore healthcare organizations should take religious leaders on board while handling and managing the COVID-19 pandemic. So next is how religion have helped us during the pandemic. Muslims have quoted the hadith, which means the speech and practices of Prophet Muhammad to promote quarantine and travel bans during the pandemic. Iza sami'tum bihi ba'adim fala taqdamu alaihi wa iza waqa'a bi'adim wa antum biha fala takhruju firaran min. The Prophet said, if you hear of an outbreak of plague in a land, do not enter it. But if the plague breaks out in a place while you are in it, do not leave that place. So this hadith means that we should avoid places that have an outbreak of a plague. So this hadith makes the Muslim abide the quarantine rules, which are the PKP in Malaysia, and stay at home during the lockdown. Mufti of Malaysia also have issued a fatwa, religious order, to substitute the Mass Friday prayer, which should be held in a mosque and is mandatory for main Muslims on Friday, with the midday prayer, which is Zuhur at home. Other than that, during the fasting month of Ramadan, Muslims were also asked to pray at home instead of communal worship in the mosque or yard, which is Tarawih. So during the Ramadan there is no Tarawih at the mosque, but Muslims only pray at home. So the conclusion for sociology aspect is the COVID-19 is a pandemic catastrophe, and we have to use every possible option that is available in limiting the transmission of the disease and overcome the religious cliché and stigma that is shaping as a barrier in the optimal management of the COVID-19. What I just said before is religion has a role here in persuading people that preventing loss of tens of thousands of lives realistically requires more efforts than just the prayers and all. So this crisis, this pandemic, should be the time for religions as well as the religious leaders to get involved in explaining and supporting rational scientific findings to save human lives and stop this pandemic forever. So that's all from me. Thank you.